to the December edition of our traditional webinar, Ask Julie Anything. I am Mariana Nadai, Marketing and Events Coordinator at Adorbis, and I will be your host today. And we have a special session today, not only because this is the last AJA of 2023, but because we have a special guest, as you can see, together with our founder and formulator, Julianne Lee. We have with us the veterinary and human homeopath, Andrea Ring.
Hello.
Both are here today to talk about dental health. So get ready. Don't be shy and ask Julie and Andrea anything. But before we start, I want to ask for you all to switch your chat to everyone so that we can all join in on the conversation. And please use the Q&A box at the bottom of your Zoom screen to ask your questions. We will do our best to get through all of them. I also want to remind you that this session provides a judgment-free space with only the health and happiness of our animals and the planet being our core goal. So without further ado, Julie and Andrea, the floor is yours. Do you guys want to say anything?
Hi, everybody.
Hello, everybody. Thank you for joining us.
Thank you for
having me.
I know. And finally, people can put a face to the name because I'm always saying I would get a hold of Andrea Ring, and then Emily and Mariana, who the team, Tracy, usually puts Andrea's contact in the chat so that people can get a hold of Andrea. And for those of you that don't know her, Andrea was my technician at all my vet hospitals, and she had she's also a homeopath, so she's done the same program as I have in the 4-year human homeopathic medicine program. But then she also did the 3-year program that I taught with Dr. Sue Armstrong and the whole British Homeopathic Veterinary Surgeons program that I brought over, but we did it a little different. We did it for veterinarians and for human homeopaths. So she did that, but she's always had this. It's really funny because this is just a little bit of an insight thing about me and a personal thing. But I hate teeth. I hate teeth. I hate the sound of them. I hate touching them. I don't like touching my own teeth. I don't like going to the dentist. I don't like I couldn't do, even when I was a tech, I couldn't do dentals. I couldn't get near dentals. I don't know what it is about me and teeth. And Andrea and I are best friends, and she's a polar opposite. It's like, give her as many teeth as you can possibly serve up in a day. And I would be like, okay,
yeah,
the dental's going on. I'm going out for a bit, or I'm going to hide in my office, or I'm going to do all the stuff in the front side of the hospital. And you guys need to just let me know when it was over, because I couldn't even walk to the back, especially if we were doing like dental extractions or full-on dental stuff that I could hear the drills and stuff. I just couldn't even be near it. So it's an interesting thing that she loved it and I hated it. So it worked really well at the clinic. And then she did a lot of work with, I'm going to get you to tell them, Andrea, about Legendre, like who he is, and you know, you have a really good relationship with him, who's a board certified dental surgeon in Vancouver, a really, really highly respected veterinary dental surgeon. So she's got a lot of insight about teeth. And before I even let her talk, and I'm yakking away, teeth are a really touchy situation. So what we're about to tell everybody is just more information that you would already get from, you're going to get information from your veterinarian, you're going to get information from dental surgeons, you're going to get information from more holistic practitioners like us. And then you take all that information and then you choose what's best and what fits best with your philosophy and your animal's health, and just what feels best for you. So like Mariana always says, this session is to educate and support people making healthy choices and empowered choices based on the information that fits the best for them. So it's not like this is what you have to do and it's wrong if you do this and it's wrong. Like that's the AJAs are never like that, but especially with teeth, it's a very touchy, complicated, you know, area of animal health. So that's what I would like to say. And other than that, I hope everybody's getting ready for Christmas and holiday seasons, and I'm sure everybody's crazy busy. So thanks for showing up. And I'm going to just let Andrea say whatever she wants, and then we're going to jump right into questions.
That's awesome, Julie. And you brought back so many memories of us working in clinic together. And what I did mainly was when we were doing a non-anesthetic dental, so something that was just to keep the teeth clean and stuff. And I remember Julie would come in the back, or we'd be working on animals that dental surgery is not an option for them. So they're not a candidate for anesthetic. And that is something that comes up a lot, right? So we'll be talking about that today too. But Julie would come in, so I'd be working on an animal and she'd be coming back. She's like, are you done? Like, isn't it long enough already? Can you be finished now? It's like, no, I need another 15 minutes. She'd be like, just let it be over. Oh my goodness. You were so crazy about that. It's just like nails on a chalkboard for you, I guess, right?
Oh my God, I hated it so much.
Yeah. And I'd be like, gosh. And they're awake.
I just have to get this one little last piece. It's like,
I just have to, yeah.
Just finish. Do it.
Anyhow, so I don't think there is a one size fits all. And some people like to think of it that way when it comes to dental cleaning and dental health, because every animal, just like every human being, is an individual. We all have different dental needs. We all have different types of dental health. We have predispositions to forming cavities. Some animals build tartar on their teeth really quickly, and others can go through the whole life and never really have a big buildup of tartar. But so in terms of, do they need an anesthetic dental? Can you keep their teeth clean? Can you do non-anesthetic hand scaling? How appropriate is that? There's a big controversial subject in this day and age, because with non-anesthetic dentals, you're not going to see what's going on with the bone. You're not going to be able to get really up far into the gum line, but you can see a lot. You can see a lot of what's going on in the mouth and whether there are any problem areas. So I think every animal needs to be individually looked at as to the state of their teeth, what kind of dental help they need, and also the big thing is prevention. So when you're starting an animal off as a young animal, how do you keep those teeth healthy through their whole lives? So appropriate diet is really important. Learning how to brush teeth and keep teeth clean, and also how do you naturally keep teeth clean, chewing bones. It's hard sometimes to get cats to do that, but there are ways that we can certainly keep teeth healthier, because we'll always look at the parallel of what are the wild animals doing, and they're not getting dentals and they're not getting anything else. How do they keep their teeth from rotting away in their mouths? They might break teeth, but they're not having the same dental problems that our companion animals have.
No, and usually when they're breaking their teeth, they're not dying from it.
Yeah.
Right? Like they're not getting like massive infections and not going on antibiotics and things like that. So I think you're 100% right. It's like, how do you like, what's actually happening in the mouth? And why are we seeing so much dental disease in people too, right? Like it's not just animals, it's people as well. People are having a lot of dental issues and gum issues and all of that stuff. So yeah. So Mariana, I think you had a question, and then we're getting a ton already questions in the Q&A I'm looking at.
So I guess we can start. The question that I have is how to prepare and follow up for dental cleanings when the pet goes under anesthesia.
So preparing, and then the follow-up care, if they are having an anesthetic dental procedure, it depends on how extensive the procedure is. Are they having extractions? Is it a mild cleaning or a moderate cleaning that they need? But the biggest impact from that is going to be the anesthetic. So the cleaning isn't so much a problem, or even an extraction isn't as big of a problem. It's recovering from the anesthetic and reducing the recovery time in terms of their healing. So there are great homeopathic remedies that we can use pre and post dental. Arnica and aconite given beforehand, and then arnica, aconite, nux vomica, and phosphorus
Phosphorus, yeah.
given after. So that's for inflammation, the shock of what's just happened to them. Phosphorus and nux are really good for getting anesthetic drugs out of the system, helping the liver recover, helping them recover more quickly from that. And the arnica is really good for inflammation. Hypericum, homeopathic hypericum, really good if any extractions have been done. And also symphytum for any of the bone pains they might be having. So yeah.
The thing that's easy to do and get to is like our Jump for Joints is really good for that, right? Because it's got arnica, ruta, symphytum. It's a really good supportive for any kind of periosteum damage, which can happen in dentals, bone healing, inflammation, trauma. So yeah, even if you did that, but what Andrea was saying, like the nux vomica and phosphorus is really good to help with the kidneys and liver for anesthetic.
Mhm.
And using in hypericum and using just making sure that their immune system is really strong before they go in, right? So making sure that their gut's healthy, making sure that their immune system is primed to deal with all of the bacteria that they're going to be swallowing during a dental, which is a big one. That's why they sometimes start animals on antibiotics prior to dental surgeries, is because the bacteria showers on the heart valve. So older dogs with really, really bad, or cats with really, really bad dental disease, there's a concern of, it affecting the heart a little bit. But, you can definitely support the immune system and ramp up their immune system for that by looking at lots of antioxidants and, really good food and probiotics, just to get their immune system as strong as you can. So that's going to actually answer a couple of other questions, because there's a couple questions in the Q&A about what homeopathic remedies to give. So maybe somebody, I know Emily's on here, right? Maybe Emily could just write in the chat quickly so that people can take pictures of it. Is Jump for Joints is a really good one. And then all you would actually need is aconite. And, you could do anything from aconite 30C to 200C. And then that's more for the healing and inflammation and trauma of the mouth, right? And then or even not even the mouth, like, I mean, Andrea, maybe you were going to talk to this as well, but when you're, depending on where you go, right? Like, there are some clinics that are incredibly conscientious with dentals, and they're, really proficient, and they get in and they get out and it's fast. But the positioning of the head and the neck and the jaw being like open all the time, there's a lot of trauma on bone and nerve, like nerves, like the spinal cord, all the TMJ joints and all the nerves that are,
TMJ. Yeah.
yeah, and the
Lots of
TMJ.
animals get a lot of TMJ afterwards.
Yeah, for
Yeah,
sure. So
for
that's
sure.
why the Jump for Joints would be really good, because it focuses on cartilage and bones and ligaments and all that stuff. And then Emily, if you're going to write in there phosphorus, I would do, Andre, you do usually phosphorus 30 and nux 30, right? Or 12 and 30.
Yeah, usually at least a 30, but if they're really, really having a lot of trouble, I might add in a 200C. But 30C is usually quite appropriate for
Yeah.
that crude, detoxing.
Yeah. Yeah. And then what else was I going to say? Was I going to say something else? And sometimes if they are traumatized, you can keep giving them the aconite after, right? Like even just for an entire day or a day and a half. And yeah, those would be in hypericum. Sorry, Emily, if you can write in hypericum. as well. And hypericum, I would try to go up to a 200. Don't you think, Andrea? Because nerve pain can be really
Yes, at least a 200, yeah.
hmm So those
And
would be
then
the remedies.
people will probably ask, well, how do you do these remedies? So whenever you have an acute situation going on, which surgery is acute, so they're coming out of an acute trauma that's happened, you always want to give remedies probably even every hour for a couple of doses. Then you go every 2 hours for a couple of doses, and then probably every 4 hours for the rest of the day. So that's the day of surgery. And then the next day, you kind of get more specific with the animal depending on what's going on with them, but you'd probably want to do them maybe even 3 to 4 times a day for a couple more days. And then once they seem to have recovered from the anesthetic, you can back off or stop using the Nux and the phosphorus. But then keep up with the arnica, the jump for joints. The jump for joints is amazing. I totally forgot it has all those in there. But the jump for joints remedy, and maybe hypericum as well, if they seem to be really painful in the mouth. So 3 to 4 times a day until they seem to be feeling, they seem to be feeling a lot better.
Mm-hmm.
So that's kind of a usual protocol. And then I usually individualize it depending on, if they're really not doing well or if they're recovering way more quickly.
Mm-hmm. Yeah, for sure. Okay, so do you
Okay,
want
great, thanks. Do you want me to read or do you guys wanna?
well, do you want me to read it? I can read the first
No,
one. It's a
I
long one.
I can read it, up to you.
Okay. Okay, go ahead.
Okay, so Amanda is asking here, her 7-year male beagle recently developed the following mouth-related symptoms. 2 smooth, raised mouth sores. 1 disappeared after 1 week. A cringe face, think Elvis lip while yawning. Big, bad breath. Excessive salivation after eating. Increased water intake and output. Tartar on upper molars only. Scratches at jaw, eye, ear area. Sticks tongue out after each bark. Hacks after drinking water since the 2021 adoption. Tested negative for tick-borne diseases, including Lyme, and waiting on a leptospirosis titer since a test showed previous infection or vaccination. Lepto vaccine was 2 years ago, and he leaks urine often on walks. Dentist appointment in 2 weeks. Thoughts on what questions to ask in order to achieve diagnosis. I would rather not use anesthesia, liver and kidney concerns for imagine, but if he has an infection, bacterial, viral, I would like to treat it. I'm not sure how to tell if the root cause is in the teeth, jaw, throat, etc.
The
Big one.
Yeah.
It is a big one. Huh.
So I think how we should approach that is what questions to ask. I think that's a really good thing that she asks is like, what should she ask? Because there's no way Andrea or I could even remotely think what that would be. My first concern that I would ask them to rule out is some type of a tumor, some type of a bone tumor in his jaw, right? In the jaw, or especially like when he barks, or a tumor maybe down in, somewhere in the larynx or trachea, or somewhere in the throat. This is a tough one because if it's not his teeth. So when I look at this, if this is not his teeth, putting him in it is something like a tumor or something more life-threatening or something more like a deeper disease than just his teeth, putting him through a dental surgery and especially an anesthetic, and then having his jaw like opened like during the surgery, he could wind up being a lot worse than what it would be beneficial for. I think for me, if this was my dog, or a dog we were seeing in the clinic, I would want to try and rule out some major major situations before I did the dental, like pre-dental. Maybe take him, I'm thinking, an MRI or a CT scan or at least some really good x-rays. The problem with dental x-rays is they need to be under an anesthetic, a proper anesthetic, to actually get proper dental x-rays. So then you're dealing with the anesthetic. And then also if you have a CT scan or an MRI, the same applies. They're going to need an anesthetic. So as I'm talking, I'm kind of working this in my head. What I would probably do is ask your veterinarian for a referral to a specialty clinic and that has a board certified dentist on board. And I would take him in and have everything done. And what they'll do is what they may do is put him under a general, and then they'll either probably do a CT or an MRI, and then that would show if there's anything super invasive in his throat or his trachea or something, or in his bone, and do some dental x-rays. They might be able to do everything and then rule out anything scary first. And then if it is just his teeth or they don't see anything bad, then move right into the dental. And if it's a dental surgeon, it's usually way faster, which is then a lot better for their kidneys and their recovery is to get in and get out as fast as possible. That's what I would do. And those are the questions that I would ask. And you said something about liver and kidney concerns. The last thing you want to be doing is an anesthetic and then not even achieving what you need to achieve, because that's not what's going on, if it's not his teeth. And then dealing with something that is really, maybe something a lot deeper of a disease, and then you've messed around with his mouth and given a general and maybe unnecessarily. And the worst case scenario, doing it that way, meaning like going to a specialized clinic and having them sort of go, okay, do this bing, do this bing, do this bing, do this bing, and then done, is that you're in the hands of they've got the technical ability to rule stuff out right away. And then you're not, you're not sitting there going, I wish I hadn't done the dental. If I'd known this, we wouldn't have done the dental, or awesome, it's his teeth. Right. And then you're just getting in and getting out. But as far as the bacterial viral thing, we're going to be doing a live not a live, but an AJA at some point. We were just talking about it today, about actual immune system and how it works, and understanding the immune system and how to do specific things with the immune system based on whether it's viral, bacterial, autoimmune, because you want to do different things in that situation. So as far as bacterial or viral, it's very similar. So we don't have to worry about that. You would really want to make sure, again, I know I always talk about guts and things like that, but your animals and our immune system is based on how healthy our gut is. So before, if you're really worried about the bacterial viral component of it, I would be really, really digging into making sure that you're rotating his probiotics and making sure that you're giving functional prebiotics and as many diverse probiotics as you can possibly give him. So that was a lot, because I just felt like there's just so much there. What do you think, Andrea?
Yeah, I agree with you, Julie. I think what the thing that needs to be done first is the vet needs to have a really good look at the mouth. So these raised mouth sores, are they superficial, or does it feel like there's something more there? The fact that he's acting like there's something going on around, like he's sticking his tongue out after he barks, like there's something going, could be jaw, could be throat, or it could be mouth, but it doesn't sound like his teeth are actually that bad. So it's kind of a bigger picture of the vet exam is the first thing. Ask the vet, do they think it's something in the mouth or is there something else going on? You know, they might want to shoot an x-ray just to see if there's anything unusual going on. You know, sometimes they can do x-ray without anesthetic. They do anesthetic a lot, or sedation for x-rays a lot now, but even just a basic head x-ray might show something. Maybe some blood work to see if there's inflammation or something else showing us that it's something more insidious than just an issue of the teeth. So yeah, a proper look in the mouth is the first thing. And yeah, all the questions you asked, Julie, you know, if there's something more serious going on, definitely get a specialist involved so they can do everything all at once.
Mhm.
Yeah.
Yeah, or even, you know, just like if they're going to sedate them to do the x-ray anyways, then, you know, you really got to weigh out like how much sedation do you want them to have? How much anesthetic do you want them to have? Sometimes you're better just to go straight to a consult at a specialty clinic where they can just get everything done all at once.
Amazing, thank you.
Yeah.
So Christina is asking, would love to hear your combined wisdom on dental support for older dogs. I have a 10-year-old JRT.
Jack Russell Terrier.
Oh, where is it? Okay. So Jack Russell, whose teeth, gums need some care. She isn't physically healthy enough yet to go under anesthesia, so I'm looking into what I can do for her myself. Symptoms are flaky and tartar, bad breath, inflamed gums, very itchy raw lips. She does have yeast issue and obvious discomfort because she rubs her face a lot with her paws, forearms. No broken teeth, and she eats, chews fine. Feed freeze-dried raw for a little over a year. Thank you so much for sharing your precious time and wisdom with us. So grateful for you, ladies.
So the main symptoms are plaque and tartar, bad breath, inflamed gums, very itchy raw lips. Okay, she does have yeast issues, obviously discomfort. Okay, well, Andrea, go ahead.
So 10-year-olds. So I run into this all the time with people that have elderly or aging animals and they don't want them to go under anesthetic. And this is a very big issue because sometimes after you put them under anesthetic, they really, really have a hard time. And some of them are never quite the same after. So when we're dealing with an older animal and also an animal, you know, like the dog we just heard about, the beagle with liver and kidney issues, how important is it for them to have a dental done? So with a 10-year-old, I mean, one of the sort of the thing that comes into my mind now is a little bit about prevention. So freeze-dried raw, that's really great that you're doing that. The next best thing would be to do a raw diet and get them eating some bones. So bones are the way dogs naturally keep their teeth clean. And especially with elderly dogs, you know, you can get rid of so many troubles in the mouth by feeding them some really appropriate bones. Even things like frozen turkey necks, I find, can really, really help get the tartar off the teeth. But one of the things to do is like if you can find somebody that does non-anesthetic cleaning, just to assess the mouth to see, okay, how bad are things in here? Do I really need to worry about it? Is this tartar removable? Do we have periodontal disease going on? Is there something deeper in terms of inflammation on the gums that's showing us there's something more serious going on with the teeth? Sometimes if you get somebody that you trust, or maybe, I mean, some clinics are actually doing non-anesthetic dental cleaning or just with light sedation. So sometimes you can find holistic vets or vets that are also trying to avoid anesthetic so that they can get the teeth cleaned up and really, really do a good assessment in the mouth without having to do anesthetic. She rubs her face a lot. Yeah. And the thing too is a no broken teeth. But what did you say about inflamed gums, very itchy and raw red lips? So what is creating that? Is that why she's pawing at her face, or is it because her teeth are bothering her?
Mhm.
So, Jack Russell Terrier, she isn't physically healthy enough to go under anesthetic. Yeah. So I would look at alternative ways of assessing what's going on in the mouth and what's going on also with her lips. So it could be because that her lips are really bothering her. Is that why she's pawing at her mouth?
Yeah, and what's going on with her lips? Like, does she have a food allergy? Does she have a contact allergy? Is she sleeping on something that she's allergic to? And, it's affecting the mucous membranes of her mouth, and her mouth is
Chewing,
getting super
chewing on.
itchy.
Is there a toy or a chew something that she's chewing on that might be irritating and causing?
Sometimes tennis balls. I don't know. I know a lot of people don't use tennis balls now, but a lot of the little stuffies nowadays are made from that same material as tennis balls. So they really make their teeth, their gums sore and red and inflamed. So
Mhm.
really take a look at what is she chewing on. Like Andrea said, like, are you using a fabric softener that she might be allergic to with her mouth? Is she on different, if you feed her different combined foods, like if you go, pork 1 week, or pork for a couple of weeks, and then rabbit for a couple of weeks, or chicken for a couple of weeks, whatever, and watch if the mouth is more inflamed and more itchy, because I worked with lots and lots of allergy dogs that their allergies showed up just around their face. They would get gooey eyes, itchy nose, flaky nose, dry cracked nose, really, really itchy, like inflamed mouths. And they were actually food allergies. So, before you run down the anesthetic dental rabbit hole, I would be looking at a lot of other same things that might oh, she said that she's really itchy all over. Hold on. Where did that go? Where did it go? Is
The
that the
first
bottom
one.
now? Pardon?
It's the
Oh,
first
right there.
question. Yeah.
She is itchy all over with yeast. Allergies are unknown. She doesn't chew on anything but bully sticks. And I'm careful with her exposure to irritants. Okay, what about different kinds of proteins? So if she's got yeast and allergies are unknown. Are you changing her proteins up? And when you do change her proteins up, are you leaving her on one protein long enough to see a difference? So you need to do at least three to 4 weeks, just one protein to actually see whether or not if there's going to be a shift in that. So I would definitely be looking at that, and I would be dealing with her yeast and just see if even with the yeast, if it helps to calm that down. But like Andrea said, yeah, like if she's not healthy enough to undergo, if she's not very healthy in general, I would definitely be looking at uh finding someone that's, a holistic vet or something that would do a hand scale when they're awake. And I know I've said this to Andrea lots because I'm anal about this. But if she's 10 and she's a Jack Russell, chances are she's, fairly sensitive dog. And if you do a hand scale, sometimes it's easier on them to do like four trips. We used to do like half of the front. So we would do them in four sections, right? So we wouldn't come in and hold them down and do an entire mouth, because then they get really stressed and it's really hard to do a proper job. So we would do how we would do it at our clinic, because if this was the mouth, we would do like the top cord, like the top half of the top. And then the next time they would go in, they would do either, what do you do, the other half or the opposing bottom side, so that it's not always on the same side?
It's sort of, or look, where are the big problem areas, and we try to get those cleaned up first. And then it also depends on how much can the dog handle.
Yeah.
So
Without stressing them out, or the
without
cat
stressing them too much,
stressing
if they're
them out.
handling it fine, you can do more. If they're
Yeah.
stressing or you're worried about them, then do the big problem areas. Maybe the top molars, usually at the back, are usually the biggest problem. And then the bottom, so one side and the other side, or one half, this half, and then the other two.
Yeah.
sides in
Just
the
so
front.
that, and so that they don't get so scared of it that they never let you come back and do it again, right?
Yeah.
Or, or if they have heart issues or they have like, it's just for me, it's always like try to stop on a good note so that the animal's not so stressed coming back in and having it done again. So yeah,
I mean, she's got some inflamed gums too, so it sounds like she needs some attention to her mouth. You can try brushing. You guys have a really good natural toothpaste with, I think the love
love
bugs
bug.
is part of it,
Yeah.
right? And
Yeah.
using some moistened gauze and then actually starting to try to get those teeth cleaned up. But the problem is too, if a dog's not eating any bones and there's nothing actually massaging those gums and teeth and removing tartar, then the tartar sits there, the bacteria builds up, you get gingivitis, and that's where you start the periodontal ligament that holds the gum onto the tooth, starts getting loose from that sitting there all the time. And then that can progress to periodontal disease where you get bacteria going up into the
Mhm.
root.
And
the bone.
we used to teach people all the time with chicken necks and
Yep.
turkey necks. And
Yep.
my favorite thing with that was my dental that was my dental input, was showing people how to put a glove on and hold on and hold on. It's like, okay, well, Julie can show you how to help with their teeth,
Yeah.
not touch their teeth. And you just put like a plastic glove on, something like that's really holds the slimy turkey neck or the slimy chicken neck in place. And then take it, let them chew on it, teach them, even cats, and pull it right to the back as far as you could possibly pull it. So let them chew on it. And as they're chewing on it, pull it back and back and back and back and back and back, and see if you can get them to hold it back there and chew on it for a little bit, right? And then you just turn it around and do the same thing on the other side. And when you're doing that, you're doing the top and bottom, right? Because you're on one side, and when they're chewing, you're it exercises their mandibular joint. It's a really, really, really helpful process and it doesn't stress them out, right? If anything, it increases their
Endorphins.
endorphins and stuff and calms them down and makes them happier. Yeah. So that's another thing that you can do for older dogs and cats too. It's really good to teach kittens how to do that. When you get a kitten, teach them how to chew on chicken necks, raw chicken necks. That is such a helpful thing, because cats usually get really bad teeth. So that's a really, really good way to prevent dental stuff with especially small dogs and cats.
Good, great. And since you guys mentioned the love bugs, we prepare for everyone attending the webinar today a special gift for you guys. So we are gonna share our natural toothpaste, that a recipe for it that we have, and also I wanna share with you that all of you guys are gonna get a 10% off on our love bugs from today until December 31st. And we will also be sending you the replay of this webinar in a few days, and also a reminder about the promo code and the recipe too. So stay tuned for the replay, and also get the recipe here in the chat, and don't forget to use the promo code TEETH to get the 10% off on the love bugs.
Awesome.
So the next question, just a second, okay, it's from a anonymous person. So my dog has chipped her canines. How do I care for them, and when do I need to be concerned about it? Can I still give her meat meal bones?
Chipped canines. Well, it depends on how badly they're chipped. So if they just chip or slab or fracture the end of the canine, it's really not that much of a concern. And quite a few dogs can, if there's not too much root, if there's no root exposed, like the material in the middle of the tooth isn't exposed or not by much, and they're not painful, then just sort of keep an eye on it. Keep an eye on that tooth. They can still have bones. The only thing is meaty meal bones. I sometimes like to stay away from the leg bones, like the long leg bones, because
Femurs.
the femurs, yeah, and the tibia bones. So these bones are the hardest bones in the body, and they're much more likely to break teeth on a bone like that. So the marrow bones are like that too, right? They're those long bones sliced. It's kind of gross, eh? Cutting up my hand. But they're sliced in half, right? And that's what the leg bone is, horizontal wise. Yeah. So it's better to feed. So just be careful on what kind of bones you're feeding, especially if your dog is an aggressive chewer. So sometimes using neck bones, if you can find lamb neck bones or buffalo or bison neck bones cut, they're softer. You won't have much of a risk of breaking teeth on those bones. And also the knuckle bones that are cut, those are softer as well. So yeah, keep an eye on chipped teeth. They're usually nothing to be concerned about unless the break is up closer to the gum line, or it's like you've got a real slab fracture that's broken off.
Yeah. And you're gonna know because they'll get sensitive. So, you know, they'll start to chew on the opposite side, or, you know, depend on which canines are broken. But and sometimes if they start changing color, or sometimes you can see like a stripe, right? If the nerve becomes it really inflamed, Andre, you can just actually see like almost like a red stripe down it.
Yeah.
But a big thing that if it's really bothering them is they won't want to chew on them. They'll pull their head, or they'll twitch their face, or their I will do, you know, a little weird thing. Bridget Forshaw said, I have a 9-year-old with badly chipped canine, with a dent and exposed, no pain, and it's been broken for years. So I have to attest to that too. Like, I have a dog that bites tires, and he's broken all of his canines on my truck tires.
Oh my goodness.
Not even knowing that's what it was. My tire guy actually told me that there was someone that was probably coming in and slashing my tires at night, because I kept getting flat tires. And I couldn't figure it out. And then finally it was like he was running around barking, and I was backing up really slowly, and he cried. And then I went out and looked, and sure enough, he broke his tooth. And like by that evening, my tire was flat. My brand new tire was flat. They couldn't believe that a dog could actually bite through a tire, but he did have really strong teeth. And it's not funny, but you know, obviously he's not allowed out now he only does it to my truck. And but he has broken teeth. He's got all 4 canines are broken, and he's been like that for, oh my gosh, he's 10 now, and he's probably had them broken since he was 7 years old. And I just keep a really close eye on him, and he doesn't seem to be bothered. Like, he still chews everything and acts normal. So I look at them a lot. So yeah, I think that's something that you just have to pay attention to it. And the other thing I was going to say really quickly is I'm trying to find it. Oh, is it gone now? Is the thing gone? The question gone? I'm really
Yes,
lost.
but I can try to find in the answer questions.
Okay. There was another thing that I wanted to say. If it's an older dog, there's a homeopathic remedies called tissue salts. Hey, Andrea, tissue salts are kelp floss and kelp fleur. So if you have a dog or a cat that can't have an anesthetic in it, because it's really, really like, you know, do the teeth or have the kidneys tank, the homeopathic remedy calc fleur and calc phos are really amazing to support the integrity of the calcium of the teeth. And we would use at our clinic, we used 12C or 30C? I can't even remember now. I think it was.
We used the X potency, so you use 6X. 6X is
6X.
what we used often. It's what I still use now.
Yeah, so 6X, and also the Bio 12, which is a full round of
all 12 minerals.
all 12, tissue salts. It's really helpful.
Yeah.
I have like with horses, sometimes you have to be really careful too. I have a bunch of horses on that right now because they have really bad teeth and they're too compromised to have their teeth done. So
Yeah. That is the thing. It's good you mentioned that, Julie, because you can treat teeth. So it's
Mhm.
something that, you know, in the conventional veterinary dental world and human dental world, they don't treat teeth. Sometimes you can find a holistic dentist that does, though. So they can give you advice on supplements to help teeth, um, procedures in the mouth to help teeth naturally, but also using homeopathic remedies like calc fleur and calc phos. Also, Mercurius Viv or Mercurius Sol, the same remedy, really good for bad gingivitis, bad breath in the mouth, um, inflamed gums, and things like creosotum and nitric acid are two really good remedies, usually used in low potency to help rebuild tooth enamel as well when you have cavities in the teeth. So I do that a lot with animals to try to save teeth, to try to improve the condition of their mouth, and they can work really well.
yeah, it works really well with the horses, like really,
Yeah.
really well. Um, yeah, okay. So do you want to go to the next one?
Yes. So Bridget is asking, my dogs are seniors and all have great teeth, raw fed, but the two big dogs are allergic to chicken and beef. I find it difficult to find bones to feed them on a regular basis for teeth cleaning, and they are raw feed. How can I keep their teeth clean? I do have some raw deer bones, but the person I got them from cut. I think it's saying that to cut, giving the deer bones.
I got them from cut, so they are yeah. So
Yeah, so they're
they cut
jagged.
them, but they're
They're
jagged.
jaggedly cut.
Yeah,
Yeah.
sorry. Not sure if these are safe to feed.
I wouldn't
Mm,
feed them if they're like that. I mean, I'm so anal about bones, but
yeah.
I wouldn't. But when Andrea was saying lamb necks or buffalo necks, bison necks,
Turkey,
um, yeah, if
turkey necks would be good
depend, yeah,
for
turkey
these
if they're
guys.
not allergic to turkey, you know, if it's a
Chicken and
poultry
beef.
allergy, I'm not sure, but and sometimes, knuckle bones, like I like knuckle bones. I just really, really watch them when they're eating them. But when you get a knuckle bone, I always would tell people to cut I think it's the meniscus, isn't it? That one piece, it almost looks like it's shaped like a kidney and it's actually not attached. Or it might even be the kneecap. I don't even know what part of the bone it is, to
I
be
think it's a
honest with you.
kneecap.
And it might be, yeah. So
Yeah.
it's a piece of bone on a knuckle bone that isn't attached. It's just attached with ligaments. I cut that off. I take it right off before I even give them the bone, so that there's no way that they can get that off and choke on it. But that is a lot easier sometimes on their chewing than what Andrea was saying about the long bones. They can be really, really hard. But yeah, I would try knuckle bones. If I know I have a cat that's allergic to beef, but he's not allergic to bison. So he's totally fine on bison. So you could get bison knuckle bones. Um, like Andrea said, turkey necks or lamb necks. There's different ways of definitely different ways to do that, and brushing their teeth, giving them probiotics. um there's lots of great ways. I even know someone that was able to do um even if you can't get a toothbrush in, if you get those little rubber finger caught things that have the little bumps in them, you can use that instead of a toothbrush. And then you can feel what you're doing too with your finger. There's so many different ways to keep, and because they've got great teeth, you're already in a good position. So that's what I would be doing. But I wouldn't
Before,
use the jagged
oh,
deer
sorry.
bones, that's for sure.
No, they're jagged. Yeah,
No.
because they can chew off even a small jagged piece and it can actually
Yeah, or
cause
when
some
they're biting
damage.
it, it could
Yeah, they can get impale, but they can also get really stuck in between the teeth.
Yeah.
And then you've got this little piece of bone that's stuck in between the teeth that you don't notice for a long time.
Yeah.
Before moving to the next question, Andrea, if you can please repeat the remedies that you mentioned about the previous question, because Emily wants to write down the chat.
Sure. So the remedies that Julie was also talking about is calc, C-A-L-C, fluor, F-L-U-O-R, or calcarea floricum, and calcarea phosphoricum. So C-A-L-C-P-H-O-S in a 6X potency. Merc Viv, which is M-E-R-C. The full name is Mercurius Viv, which is V-I-V. So that was for gingivitis, really inflamed gums, bleeding gums, really bad smell in the mouth. Creosotum, K-R-E-O-S-O-T-U-M, really good for crumbling teeth, breaking teeth, cavities in the mouth. And then the other one really good for that is nitric acid, N-I-T-R-I-C acid. And low potency, so 6C, maybe given twice a day for a couple of weeks and take a little break, reassess, and you can sort of pulse those remedies for a while. The X potencies, the tissue salts, you can keep them on daily for a long time.
Mm-hmm.
X potencies, you never have a risk of causing any aggravations or provings or anything like that. It's homeopathic principle, right? X potencies you can give, they're almost like a supplement, but they're still homeopathic.
Okay, and Emily also asked for the homeopathic salt info that Julie that you mentioned.
Yeah, that's what
Tissue
Andrea said.
salts.
It's called
okay,
tissue
sorry.
salts. So a way to find them is called Bio12, the Bio12 tissue salts.
Okay, thank you. So Chris Mitchell is here saying that, as you may know, my dog Breeze was severely damaged at the vet while under anesthesia, as they did not turn her correctly while under anesthesia and dislocated her vertebrae. Not only that, her mouth is still infected after 10 months. She does not want to be touched in order to brush her teeth. Is there something to put into her mouth to stop an infection continuing and help reduce further complications? Would you recommend? Antibiotics have been used. It could be unsafe to put her through another surgery at this time.
Well, the mouth is still infected.
Yeah, first question I have for that though is, has she seen a osteopath? I would make sure I took that dog to an osteopath. I think that would be something that I would be looking at like ASAP. Just because, you really do want to address the concern about her vertebrae, right? Like that's a big one. Like that's massive, So
Dislocated.
so chiropractics, acupuncture, I really, really, really like osteopathy. It's like my favorite thing now. So if you could find an osteopath that works with animals, especially if she still doesn't want to be touched. If she doesn't want to be touched, aconite, arnica, and hypericum, because if she doesn't want to be touched, she's clearly still in pain. So looking at nerve homeopathic remedies, and then, things like if there's an infection, and Andrea, things like hydrastis and hepersulf and calendula, silica, like all of those homeopathic remedies are incredible for infection, and I guess a low enough dose, maybe, I don't know, like you could do high and then go low, but something like this I would say would have to stay on it for a while, like kind of till it resolves, basically.
Yeah, I think because she's so painful to start with, a higher potency of arnica and a higher potency of hepersulf to try to get out of this really painful stage in aconite. Even the jump for joints would be good.
Yeah.
For this musculoskeletal and spinal issue.
Yeah, yeah.
think.
So Jump for Joints would be really good for that, and Hypericum together would
Yeah.
be really good for that.
And
Emily, can you throw in Jump for Joints there, please? And also, I think that chamomile too. If she's really that painful, chamomile is a really good tooth remedy, right? It's really, really helpful for teeth, and it's helpful for pain in general. Um, uh, so chamomile would be a really good one. Seeing an osteopath, and I always have to go back to making sure that her immune system is strong enough to combat it. Like the nice thing about putting a probiotic in their food, like a powdered probiotic in comparison to like a pill, is that when you're mixing it in their food, yes, it goes into their gut, but it's also going into their teeth, right? So you're getting some, if she won't let you put your finger in her mouth because she's painful, then when she's eating, if you add, and you don't have to worry about giving like too much love bugs. So you could dose her quite heavily with the powder and just mix it a little bit on the top so that when she's actually eating her food, she could, the love bug is actually going on her gums and in her teeth, like in around her teeth. So you can put it in their water. Sometimes I'm hesitant. Oh, you know what you could put it in? That would be really good is if you could put it in some yogurt, some raw goat milk, or kefir. If you put the love bugs in that, and a fairly high dose of it, because then when she's licking it, that's going to, disperse throughout her teeth.
Great, thanks. Linda is asking here, Lily is having a dental in 2 weeks. Her upper last molars discolored, inflamed, may or may not need to be extracted. Should I give her liquid constitutional allergy remedy in the morning before appointment or wait until after?
Liquid constitutional allergy.
Constitutional. So I know Lily.
Oh, okay. I'm like,
Yeah.
I don't know what this is.
I think we should give her some other remedies beforehand. Constitutional, her liquid constitutional. Maybe, but we should give her pre and post remedies, but I want to talk to Linda about it. So,
Okay.
yeah, the discoloration on the teeth. It's if it's just a discoloration, maybe she just has a bit of tartar on there. So I would kind of like to know a little bit more about what's going on with Lily's teeth, but if she does need the allergy remedy, because she's probably worried about the reaction to the drugs.
She said
So
that
that's
one is
probably
brown. Sorry to interrupt.
one is brown. So is it
Yeah.
the tooth or is it just some tartar built up on the tooth? Probably giving her, yeah, because she might react to those drugs. So giving her allergy combo ahead of time would be a good idea, and probably after, but also those pre and post surgical remedies for dentals.
Okay.
Yeah.
She said that she would be sending you an email with a pic.
Okay.
So, okay.
Okay, good.
So, just a second here. Tony is asking or saying, I don't know, it's a big one. Is there any way Julie can also talk on, in her opinion, if dog canines can be safely pulled or are they attached to the jawbone and whether it is or not safe to pull them? I rescued a dog that lived her life on a chain. In chewing the chain, she broke off many teeth and all 4 of her canines are broken. They are still showing, so not under the gum line, and they look somewhat sealed, so no hole or root showing. They have been this way for most of her life, and she's about 9 or 10 now. It's a boxer. I need to get her teeth cleaned and look for other cracked teeth. She had one molar removed that was cracked into the gum line. So what's safe for these canines? Doctors want to pull them because they are in half, but they are not infected and they do not seem to be painful. I'm okay with pulling teeth if needed, but have heard stories about cracking a jawbone when pulling a canine. A canine, sorry. I would appreciate hearing her thoughts or your both thoughts, I guess, if we're going to talk about dental. So she is in a bad shape when I rescue her, but she's healthy now. Healthy now.
So, okay, if there's any teeth in the mouth that you want to try to save, it's the canines. The canines really help with the whole structure of the jaw. So that's also really try. And it's not bad if you have to lose one, but you want to try to keep those canines intact. So they are the most deeply rooted teeth. So what you see sticking out, the full length of the tooth goes just as much up into the jawbone. So when you pull a canine out, it's crazy how deep the root is. So if those teeth aren't bothering her, and I'm so sorry that she came from such a horrific situation, but thank goodness she's with you. And if you've had her for a long time and these teeth don't seem to be bothering her, they're not terribly discolored. It doesn't look like there's inflammation, swelling, bleeding gums, all that stuff around those teeth. I don't know. I would probably just keep a really good eye on them. And if you notice some changes in them and maybe they need to come out later, I would try to keep them as long as you can.
Yeah, a 10-year-old boxer.
Yeah.
I mean, I think the really big word here, or the big, like, what's important to read here is that she's had this most of her life.
Mm-hmm.
So if she's been able to cope and not get serious infections and really sick, and painful mouths and massive gingivitis and things like that, now that she's in a good home and she's not chewing on her chains and she's being taken care of, I personally wouldn't touch them unless there's a really big problem with them. Like unless the gum is raised and inflamed and we know that she's got, infection going up the gum line and all of that stuff. I would agree with Andrea 100%, and I would just keep an eye on them and not get talked into pulling them out. And it's interesting, so that she had a cracked canine. I wondered, I would love to know when did she have the crack, or not the cracked canine, when did she have the other cracked molar or the other cracked tooth removed? Because if it wasn't that long ago, chances are I don't think it would be a big, just wondering why she needs another dental. So, like, I'm just questioning. She had a cracked molar about a year ago. She had a stab wound she had surgery for. They took it out then. So, is she just having a routine cleaning then now? Is that what they're doing? They're just routinely cleaning it? Because I'm just not a big one for pulling teeth out unless they absolutely, I mean, if they're loose or they're going to cause further damage, yeah, you want to do as much as you can when they're under general anesthetic so that you don't have to go take them back in and do it again. But, if they're not causing a problem, I would be very careful to not be pulling out her canines. So,
Yep.
Great. Mm-hmm.
And again, if you've just gotten her and you've rescued her, lots of probiotics, lots of superoxide or superoxide dismutase, like in our phytoplankton, lots of things to stimulate her immune system and keep her immune system really strong so that she can naturally fight infection and bacteria that comes in her teeth, comes into her mouth.
Great. Helen is asking here, my maybe 5-year-old cat has a lot tartar on back teeth and a red line on the gums. Will a known anesthetic cleaning be enough? And can the state of teeth tell you the age of them?
Sometimes, but some young cats can get really bad teeth quickly too. So you kind of can tell, that's usually how they tell age of a cat is by the condition of their teeth. But if it's an adult cat, it's really hard to pin it down to, are they, 6 or 7, or are they 10 or 11? So Helen, a non-anesthetic dental cleaning might be good enough if you find somebody who's proficient in cat teeth cleaning. Like, a lot of people don't want to do cats because cats' mouths can get really bad. But, I scale my own cat's teeth, and, I do scale cat teeth as well. And you can do
a lot of cat teeth.
Good job. Yeah, I know I have.
Clinic.
Yeah. And gotten bitten a few times too. That's why people don't like to
don't like
do
to
cat's teeth. The risk is higher to the practitioner. But yeah, it's 5-year-old cat. A lot of tartar on back teeth and a red line on the gums. Yeah. So the red line on the gums is because the tartar is sitting there. Sometimes you get that tartar off and you see a really nice, clean, healthy tooth underneath it. And you can do some remedies after and clean it up and reduce the bacteria in the mouth. And it's amazing how the mouth can repair itself and the gums can go back to being healthy.
Yeah, and something like that would be it would be really good to try to see if you can get that cat on chicken necks.
Yeah.
And that would be the one where you would pull it as far back in their mouth as you possibly can go. In order to just really wear off that tartar naturally at the back. It's amazing. It's amazing. Chicken necks for, fairly short period of time. It's quite amazing how fast you can get tartar off of their teeth. It's incredible.
Yeah. Sometimes you can even go in there with your fingernail and you can, if you get a ledge on it, you can snap it right off. So can you imagine chewing a bone? It just scrapes that stuff right off of there. It's really amazing.
Great. And since we're talking about cats and chewing bones, Annalise here is asking how to get cats to interested in bones, specific if they have never been outside and had live prey and had live prey. Sorry. What's the alternative if they won't chew bones? Jerky?
That is a tough one. It can be tough to get, like none of my cats eat bones, but they eat live prey as well. So technically they do. Can be tricky. They either seem to take to them or they don't, I find.
Yeah.
What do you think?
There's I've done so many crazy things to try to get cats to eat bones. It's ridiculous. I've taken chicken necks and sliced them, like sliced the skin and the meat, and soak them in tuna juice or soak them in salmon juice, so that literally when you take them out, they no longer smell like chicken, they smell like salmon. And they'll start that way, spreading really stinky canned cat food on them. There are different ways to try to entice them. I don't know if there's anything that is like really non-bone that you can use for cats that would work the same way. A jerky wouldn't, because jerky's too soft. It really has to be hard enough that it starts to move the tartar around, like actually scrape on the tartar. So yeah, I know. So that's why I always try to, when people used to come in with kittens to the clinic, we would just try to just really have them do everything in their power to get their kittens to start them on bones, because when you can start them young, it's makes all the difference in the world. So for my cat, I used the soft part of the chicken wing and held it with a paper towel, just to kept offering. Yeah. taking the chicken skin and chicken meat off first, getting them used to eating like the long pieces of meat or the long pieces of skin, that they're not like little tiny kibbles or little tiny pieces of food. Like just getting the cat used to having something bigger in their mouths, which is, when they're hunting, they're used to doing that. And it is actually their natural, the natural way that they would eat is putting their mouth over in a whole mouse or something. So having a lot in their mouth. But when they're so used to eating kibble or eating canned food, or even like mixed raw, that doesn't happen. So, maybe taking it and slicing it off and making longer pieces that they actually have to chew, there's lots of different, go see. Oh, Henry. Freaking me out. I don't know why he's barking like that. So yeah, it's just it takes so much patience. I remember when we used to try to get cats to eat raw and they were like completely addicted to kibble.
Mm-hmm.
I used to tell people to take the raw and make tiniest little meatballs and then take kibble and make, take a rolling pin and make like a powdered kibble and then roll the meatballs in the little kibble and put them or put it on anything to try to like trick them into eating them. So, hopefully they can.
I have a question here that it's not 100%, I guess, related to the dental health, but it is in a ways because it's some of the symptoms of this kind of disease. The jaws, like part of the symptoms. So will jump for joints help with Lyme arthritis?
The arthritis of Lyme disease?
Yeah.
Yes, it should. I think we just lost Julie.
Yeah, I
Is
think
Julie?
so
Okay,
too.
hopefully she'll be back here in a minute. Definitely because it's a symptom picture of that inflammation in the joints. So no matter what the cause, I mean, there are other things that can help Lyme too, because it's an autoimmune disease, but the Jump for Joints has those remedies in there to really help the health of the joint. So I would say yes.
Thanks.
Jill, I was just answering
me. I could hear banging and it was a window that was open. We're getting a big storm again. I didn't know what he was barking at. It's like, okay, it's freaked me out. Yeah, that question, if it helps,
The jump for joints?
the Jump for Joints, what if it helps arthritic
Lyme.
arthritic Lyme? Yeah. Yep. Because it, like Andre was saying, it's symptomatic, right? It's a symptom of that disease. But when it comes to homeopathy, that doesn't matter, right? It doesn't that's the beauty of homeopathy is that they don't have to have a diagnosis, right? It doesn't matter. It's how is the body responding to the situation. So, it really doesn't have to be it doesn't really matter if it's Lyme or another kind of arthritic change. But if the body is responding in the same way, then homeopathy will help. So yes, Jump for Joints definitely can help with that. And I find a really good remedy for Lyme is China. China's a really good, really good Lyme remedy, and Ledum. Ledum is also really, really good for Lyme, especially when it's showing in joints and in arthritis and stuff. It's an excellent one. So Ledum, China. Oh, Emily already did it. Thanks, Emily. Yeah.
Okay, thanks. So Pauline is asking here that is saying that have a 15-year-old BC mix with still is in good condition. She had her teeth cleaned 2 years ago. However, I think that maybe because of the anesthesia, I don't know, is showing symptoms of dementia. She stares sometimes, however, is still lively. She eats homemade food, has started some kidney issues, mild right now. I would like to avoid any further anesthetics. What concerns would a vet have in doing cleaning without any anesthetic? Would a mild sedative be available? Savi would not bite.
Well, I would hope
Dementia.
most conventional vets would be completely open to doing a non-anesthetic dental, especially a 15-year-old dog. You know, we're not talking about a 5-year-old dog that has another 10 years of having to deal with teeth issues, right? So, again, everything, you know, it doesn't matter really how old they are. Everything that we're talking about applies to all ages. So, using bones to keep the tartar off, right? Using bones to keep the tartar off, putting probiotics on their food, brushing their teeth with probiotics. You know, she started to have some kidney issues. It's mild right now. So, you know, when you think of anesthetics and high blood pressure and kidneys and dementia and cognitive disorders, they all kind of like go hand in hand with each other. You know, it's not a cat, but thyroid issues, I would add to that if it was a cat. But it, you know, I just feel I did a program with the American Holistic Veterinary Association, and I remember an amazing vet from, I don't know if you were with me, Andre, when we went to that one. I think I was lecturing at that conference in Portland, and there was
Yeah.
yeah, and one of the vets that was also lecturing was on homeopathy and dentals, and that was what his lecture was about. And he was saying that do you remember? And he was just talking about how, you know, doing dentals on older dogs and how many he's seen that they've just never recovered, right? Like it's like an older dog has this fine balance, like especially if they're being treated homeopathically and they're on really good food. It's like their homeostasis is very, very finely balanced, right?
Yeah.
And you know, and they can just crash and burn so quickly with something that is really invasive. So if she's showing signs of dementia now, I would definitely be addressing that old dog cognitive disorder, and you know, with all kinds of, lion's mane is a really good mushroom to use for cognitive disorders. Lion's mane and SODs, so the phytoplankton is really good for that. Making sure that her cholesterol and her blood pressure is really good. So, you know, looking at remedies that help support that, like phosphorus, uh, making sure that you've got lots of good probiotics on board. It's just, we can't, it's very, Andrea worked at my clinic for, I don't even know how many years, worked with me for how many years at our clinic, at all of our clinics, actually. So, when you look at teeth are teeth for sure. Like there's like specific things about teeth, and the teeth is just part of the body. So we can't compartmentalize teeth and how to keep teeth and gums really healthy. How to keep teeth and gums really healthy. The foundation of that is the same foundation of how to keep cells in the body healthy, right? That's the foundation. And then we can add things that are super specific to dental care, like bones, like specific remedies, like everything that we've been talking about today. But I don't want anyone to forget that the underlying thing of keeping animals' teeth and our gums healthy is our foundation of health in general, right? So that foundation has to go along with everything, whether it's a heart disease, whether it's dental disease, whether it's brain disease, whether it's cognitive disorder, whether it's kidneys. It doesn't really matter. That foundational high level approach to health needs to always be there.
Mhm. Yeah. It's one functioning organism. And if you have dental disease, it's reflecting in the overall health of that animal as well. So the more we can do to help the body be as healthy as it can be, the better the condition of the mouth is, the better the body's ability to deal with bacteria and to deal with infection and to feel good and be healthy overall.
Yeah. And coenzyme Q10 is a really good, I wouldn't use it long term, but coenzyme Q10 is an amazing supplement for gum disease and as a prevention for gum disease. And it doesn't hurt to use it like, twice a year, even putting them on it twice a year or 3 times a year. Things like, if dogs and cats, if you're concerned at all about heart disease, coenzyme Q10 is really good for the heart. It's also really good for the brain. So, looking at that as well, those are my real big go-tos when it comes to dental stuff, is coenzyme Q10 and phytoplankton for the superoxide dismutase. So from a supplement point of view, and then clearly, liver support, because they're constantly swallowing the bacteria, keeping the liver and kidneys clean and the blood clean. Also the making sure that that you're doing everything possible from a diet perspective. It's all part and parcel.
I think it would still be worthwhile with that dog if it was post-anesthetic, that it has had more dementia or brain-related type issues, is to do a detox with Nux vomica and phosphorus in a 30C potency, and maybe
Liver tonic too.
liver tonic and the chelating ability of the soil and sea with the chlorella in there would be really, really helpful.
And the fulvic and humic acid, right? Helps with toxin. That's a good point.
Yeah.
Yeah. So that's, detox Nux vomica and phosphorus, and also soil and sea, and what else did you say? Soil and sea, and what other one? You said something else.
You said the liver
Oh, and
kidney,
liver tonic.
liver tonic, and you were talking about some mushrooms too for brain health.
Oh,
right.
Brain health is like lion's mane.
Lion's mane.
Yeah.
Guys, it's getting kind of late. I don't know if you wanna
I know.
answer any, just maybe the last one. Is that okay?
Yeah.
Okay, so Wendy is saying here, I have a young small dogs who have had extractions already. I try to brush their teeth, but don't get a good brushing, especially on the bottom teeth and inside areas. I have tried everything, including coconut oil, which they love. They will let me in for seconds only. What do you suggest to help keep their remaining teeth? They are feed cooked and raw with quality supplements, and one has high anxiety.
Quality supplements, high anxiety.
Kind of everything.
Already extractions. Yeah, it's kind of a small dog predisposition, depending on how small they are. It's really, really tough.
Well, I mean, everything that she's saying, we've sort of discussed, right? Like when I was saying, like when we were anal at the clinic about small dogs and cats, getting them on chicken bones, right? Chicken necks. It is like, for me, the number one proactive preventative care, like number one, along with really good gut health, right? So that the bacteria is being dealt with even on from a gut level. Fed cooked and raw quality supplements. One has high anxiety. Yeah. So if you can get those dogs on chicken necks, and especially holding them with a rubber glove so that you can pull them back, it's really, really a really good way to get rid of dental disease. Coenzyme Q10 again, all the remedies that we talked about, like the bio-12s and things like that, like what we talked about before, the kelp phos, kelp fleur, and the bio-12 from a homeopathic standpoint. And yeah, in the chicken nets was what I would be doing.
Great, thanks. I know that I said that would be the last one, but I'm just curious about this one. So, what kind of bones could I give an elderly Chihuahua? I'm afraid they could choke.
Yeah, same thing as what we just said. So that's the whole reason you hold them too, right? So if you're afraid that your cat's going to choke or your small dog is going to choke or whatever, but you can't hold them with your hand because they slip right out of your hand. They're so slippery, right? So you put on a glove, and like a rubber glove, and you hold them, and it's really, and then once it gets to be small, like too small that you can't hold them anymore, then you throw it out. You don't let them keep eating it. It's one sure way to make sure that they're not going to choke on it is that you just don't let them have it on their own. You just hold it for them.
Great. Thanks. So I guess I know that we still have some questions here in the Q&A.
I know.
We answered a lot, and I guess, like you said, everything that you guys discussed and recommended, it will cover pretty much most of the questions. So this is very good.
Someone
And
asked if you can cut chicken necks into 1
oh,
inch pieces for cats. I would definitely not do that. That's the whole reason that they don't choke on big things outside when they're eating bones and stuff outside is because they're not in little pieces. They're in holes. They're in holes. So I would never recommend cutting chicken necks into small pieces.
great.
Yeah.
So yeah, I'm just so I'm trying to wrap up again. Just like for the questions that it's still here in the chat, you can guys connected to us and join our community on Facebook, the Door Beast Collective, and post your question there, and we will be glad to help you. I would like to thank everyone who joined us today. And of course, thank you, Julie, and thank you, Andrea, for this amazing discussion and for giving some of your time to us today. I wish you all a great night, and don't forget to subscribe to our newsletter so you can sign up on our website to get all the information about Outdoor Beasts, our promos, new blog postings, and a future Ask Julie Anything sessions. Thank you so much, everyone. I wish you all happy holidays and see you all next year. And don't forget to use the promo code TEETH to get the 10% off on our love bugs. I'm sorry, I was keeping talking and talking. I'm sorry. Maybe Julie and Andrea want to say some final words to everyone.
Go ahead, Andrea.
I just want to really thank everybody for being here today because it's probably one of the biggest questions that I get all the time in practice. Okay, what do we do about the teeth now, right? And what is really essential and what I've been trying to do, and I know you guys are always trying to do, is get young dogs and cats started off right. So try to make it so that they never even know what kibble is, so that they go right on a raw food diet. They will take to it as naturally as a duck would to water if we get them started early. And eating bones, eating a species appropriate diet is the way we keep the bacteria load in the mouth down. It's the way we keep the mouth fresher. It's their whole body and their whole immune system and their gut, and everything will be working symbiotically when we do that. And getting them onto bones like right away. So bones are really, really great way with puppies and kittens when they're teething. You give them a little frozen chicken neck. They'll chew it. They'll get used to chewing on it that way. It feels good in the mouth. So, once they get older and once they're established into their patterns, it's harder to get them doing that. But starting them off right. So, you do your best for your animal who's older now. When you get a young animal, then you want to start them off right again. So really prevention is the most important thing about teeth. And I think we've shared enough today that gives you enough tools to know how to deal with these dental issues when they come up as they get older.
Yeah. All right. Well,
Amazing.
Happy holidays, everybody. I feel really like lucky having this with Andrea because spent like a week with her in Vancouver. I just got back a little while ago. It was amazing.
Yeah.
I actually sat exactly where she's
Okay.
sitting right now and did a podcast with Dr. Judy Morgan.
Yeah.
So yeah, everybody, I hope you have an amazing holiday, a safe one. And I always say I did my little thing today that's going to be posted for Christmas, but I think that the gifts that our animals give us are sort of everyday. I can't imagine getting anything under a tree that is more important to me than the love that I have for my animals and what they have for me.
Mm.
Can't really compare them. So thank you so much and happy holidays, safe, big hugs to all your four-legged friends, furry, lizardy, horsey, piggy, whatever, whatever they show up at.
Amazing.
Okay.
Thank you.
Good
Thank
night,
you
everybody.
again, you
Thank you
too.
so
Thank
much.
you.
Thank you,
Thank you,
Andrea.
everyone.
Thank you, Mariana.
Thank you,
Thank
Julie.
you.
Thank you, Mariana. Thank you, everyone. Happy
Okay.
holidays.
Stay safe,
Bye.
everyone. Bye.
Bye.